Ian Lang. I live in West Orange. Hopefully going to have surgery to get rid of my glasses so I can see like a human being.
Before I had glasses, I obviously needed to wear my glasses all the time. It got to the point that I had to have them on 24/7. I had the implant put in. Now, obviously, I can read the newspaper. I can read my watch. I can tell the time. I can watch television. I can see the dashboard on my car. Everything's nice and clear.
The lens that we have in our eye is normally a clear lens, and as we get older, the clear lens starts to get cloudy and it starts to prevent light rays from entering the back of the eye. And that's what a cataract is. So when we do cataract surgery, you are actually removing the natural lens from the eye and we're putting an artificial lens in its place. Patients that wear bifocals now and do not have cataracts, we can still remove their need for bifocals with the ReStor lens. This is called a refractive lens exchange. It's the same thing as cataract surgery, except for the patients don't have cataracts. So for these patients, they're able to wake up, see the alarm clock, watch TV, drive a car, work on a computer, and read without glasses. So it's a great way to eliminate their need for bifocals. Prior to the day of surgery, a number of preoperative tests are performed at our office to determine both the health of one's eye and the proper implant power that is necessary to eliminate the need for bifocals following cataract surgery or refractive lens exchange.
So doctor says you have a cataract and you need cataract surgery.
Yes.
When you have surgery, doctor puts an implant in your eye. You have a choice of implants. You can either go with a standard lens,
Right.
in which case you'll need to wear glasses afterwards. You may need them for distance, you will definitely need them for reading. Or you can go with what's called the ReStor lens. This will eliminate your glasses completely. You won't need them for driving, you won't need them for reading.
I would prefer that.
Okay.
Absolutely.
Are you
Isn't that the
having-
whole point of kind of doing this, really?
Yes, yeah.
Do
you
some
want
people
to-
want to use their glasses afterwards?
Some
or
people don't mind wearing reading glasses after cataract
it
surgery.
kind of defeats the whole purpose of what I'm doing this for.
Exactly. Procedure itself is very easy. You'll be at the surgical center probably for a couple of hours, 2 to
Okay.
3 hours. But the procedure itself is about 20 minutes. You'll see, the anesthesiologist. Afterwards, you go into recovery, and they go over all your post-op instructions with you.
So they put you out for this?
You're not asleep, but they give you that twilight medication.
Gotcha.
So you're nice and relaxed, and you're aware of what's happening, but you really don't care what's happening.
Great. Excited.
Yeah, good. You should be. It's like
I am.
going to change your
It's
life.
10 years since I'm wearing these glasses,
Yeah,
and it's
yeah, you're going to be very happy.
I've had it.
Very excited.
I've had it.
Yeah.
Because I
The
can't see.
procedure, yeah. The procedure
Distance is
so
okay,
easy.
but it's the reading part that's just frustrating.
Yeah.
This is great.
Yeah.
Excellent. Thank you very much.
You're welcome.
Appreciate it.
Get into the surgery center. They'll sit around and wait their turn for the surgery. They'll go to a preoperative area and they'll receive some numbing drops, get an IV for some sedation. When their turn arrives, they'll be brought to the operating room. They're going to lay down flat in the bed and they're going to be prepped and draped. The surgery itself takes 10 minutes. Following this, they go to recovery room, give them something small to eat, go over their post-operative instructions. They go home and rest the rest of the day. They wear a shield at bedtime. And our office generally calls them that night to make sure everything's okay, and we'll see them in the office the very next day. Basically, during cataract surgery, what we're doing is we're using an instrument called a phaco emulsification probe, and what this does is it takes the cataract and breaks it up into tiny pieces, which we're able to remove with irrigation from the eye. Once the cataract is removed, we're able to put a foldable implant into the eye in the same place as the original cataract was, and this allows light rays to refocus back on the retina. Cataract surgery is an outpatient surgery. It takes about 10-15 minutes. You're at the surgery center for about an hour or two altogether. Go home without a patch on your eye, and most of my patients are back to work the very next day after the cataract surgery. The ReStor lens has concentric rings on it, which gives them near and far vision, but these rings also cause them to have halos at night while they look at a bright light. This tends to improve over time, but patients do notice that after the surgery.
Had surgery in your right eye yesterday, the cataract surgery. How's it feeling?
Feels good.
Good.
A little irritated, a little blurry. Other than that, I feel fine.
Good, good. Now, did you take your drops yet?
Yes, I did this morning.
Okay, good. Perfect. Alright, so let me just check your vision. You're gonna take that, cover your left eye. Now, I'm gonna start high.
Okay.
It's big letters. Can you read that?
N-Z-D H-L P-H-T-C V-L-N-E D-A-O-F E-C-T-H.
It was very good for the first day. You're about 20/30, which is excellent. Alright, so you're going to be seeing Dr. Zantos. I'm going to bring you into the room.
Okay.
Alright, right in here.
Did you sleep okay?
Yeah, fine. A little blurry, but other than that.
That's normal. I'm gonna go over a couple of things. Weight training, usually about a week. A question I do get, let me just say this because I always forget this and I have people pull up in a panic. If you need to fly an airplane for an emergency, you can do that right now. So it won't affect the eye at all. For right now, if you bend over, only for about a week, just keep your chin up.
Okay.
Don't put your head down.
Okay.
Just keep your chin up. No rubbing the eye.
I wouldn't
Cook a
dare.
lot, yeah. Just
Well, yesterday, when I came home, my eye was really tearing a lot.
that's normal.
And I rubbed a little too hard by mistake.
Yeah,
Wow.
Yeah, it hurt. Right?
Man, did it hurt.
And you might notice some itching.
I haven't had any itching. It just kind of feels irritated, like somebody poked me or something's in my eye, and it just.
But as you heal, everything kind of comes back together. So you might feel like there's something in your eye, like sand or hair. That's normal. And you also might get a little glare. All right, so you look pretty good. Let me get Dr. Silverman. Check up close.
Yeah. Yeah.
How far down can you go without glasses?
95, 874, 2843.
That's a big difference, you know,
Yes,
from
sir.
here to here in one day.
Yeah, and this is the eye that's not right.
I know. So this is not treated and that's treated in one day. Take a look. Come on up. Okie dokie.
Very much. Yes,
You're
sir.
doing great.
Thanks.
Okay, man.
Awesome.
It's been 4 weeks since I've had my right eye done, 3 weeks since I've had my left eye done.
Before I had
The procedure, I didn't see really much of anything. Distance-wise was okay. Anything close-up, magazines, computer, my watch, for example, was blurry. I could see the date on my watch, which I could never see before. I mean, obviously I could see the hands in some of the time because they were bigger, but I could never see the date. I never set the date. I couldn't see it. To my friends that are wearing bifocals, I would say to them, you must go to Dr. Silverman. The procedure was easy. I felt no pain whatsoever. And it's worth every penny, as far as I'm concerned. Because to me, after a while, glasses was getting to the point that it was getting a little annoying. Because if I didn't have them on 24/7, it was a problem. And I definitely would recommend it to anyone that wears glasses. It's just the greatest thing. I've already recommended. I think it's the greatest thing ever. I really do.